Hello, hello. Hi, everyone. Testing the microphone. So welcome back, everyone. Who was here yesterday? Awesome, a lot of people. What were some of your ahas or takeaways from yesterday's program? Nobody learned anything yesterday? I did. Long day. For those of you who don't know me, who are new today, I'm Denise Stegall. I am the CEO and curator at livinghealthylist.com. We are a healthy lifestyle platform that provides honest, reliable, and unbiased information on health, wellness, personal development, and bringing a little bit more fun into life. And I am your MC for this afternoon. If you have any questions, please never hesitate, raise your hand, ask. That's what we're here for. We're here to learn. We're here to educate ourselves on something new and something different, something we may not know. So I'm going to go back to that question I asked you a second ago.
You're never too old to start your new health journey.
Beautiful. You're never too old to start your new health journey. Wonderful. One more. Yes? It only takes 4 months to get over sugar. I love that. Wonderful. To get it out of your system, to not crave it anymore. I know Dr. Nedley was talking about chocolate, and all of a sudden my eyes went, chocolate. Apparently I need to start that 4-month trial without chocolate. Though I have to say, it is dark chocolate, so I think that's better. I'm going to tell myself that. Okay, I'm looking at Dr. Nedley. I'm like, yes, no. Well, welcome to day 2 of the symposium today, the Community of Wellness Symposium. We have had a couple of amazing sessions yesterday. We were busy all day learning, laughing, enjoying. Dinner last night at the Rochester Country Club was fantastic. Who was there last night? Good stuff, huh? I was really impressed with the chef there, Chef Tim. We've been to the country club many times in the 20 years that I have lived here in Rochester, and I have to say, I've never had a dinner that good there before. So today's agenda, we're going to talk a little bit about something a little different. We're talking about emotion, we're talking about stress, but we're also going to talk about passion. And I'm standing in a church, and what I'm talking about passion is probably a little bit different from what you normally hear when you're in your church talking about passion. But today it's more, we're talking more personal passion and what gets you motivated, what keeps you going. So I'd love to welcome back to the podium Dr. Neil Nedley. Yes? Yes. Sorry about that. Hello, Pastor Booth. Would you like to be introduced, or would you like to come up and say hi? You have a microphone in your hand. Come on up.
Say what you need to say, and I'll get up and I'll open the program.
Okay, that sounds great. That's all I have to say right now, and please welcome Pastor Booth.
Always nice to offer a venue for the public, for the community to come in. People don't know. Best kept secret about a church is where you go to get healthy, right? People say, oh, churches are where you... Really? It's where all the saints go. Because saints are coming to learn how to be more healthy, and God bless them. So we're happy to have you all with us today. Get your phone out and text one of your friends who should be here, but went home, took a little nap, and they probably overslept their little beeper. So invite them. There should be more coming. This is the tough segment of the day because we just ate. So happy to have Dr. Nedley with us for 2 sessions. We're going to speak twice today. Oh, very good. Let's bow our heads as we begin with prayer. Father, we invite you to join us today. Since you're the Creator, you know what makes us tick. You know what we need, Lord, to be healthy. Help us, Lord, to absorb as much as we can so we can be like you. Just
Thank you. It's good to be with you again. We are going to be talking about not only loss, but trauma as well. Trauma is something that is unfortunately part of the human experience. The recent survey, over 70% of the people, and these were of all ages, 70% of individuals have experienced significant trauma, and even more people have experienced significant losses in their life that wouldn't necessarily be considered trauma. And there are some healing aspects that are important in both of these, and some of them are similar. So, interestingly, a lot of the individuals that come through our program will state this at the end of it. They didn't even think they were going to come close to stating that when they came, but they actually are thankful for the traumas and losses in their life that drove them to need the program, because they recognize that from what they've learned and incorporated, they've actually become a better person than if they didn't have those losses and traumas. And so we can go from disappointment to appointment, and this is what we all need to learn, because it's not natural for us to know how to undergo healing post-trauma or post-loss. It's just not a natural thing that humanity knows how to do. And sometimes we're wounded just from doing our job. Soldiers obviously are wounded, and sometimes wounded for life as a result of just doing their job. Often the losses are unexplained in our own life as to why. And of course, there's an example of Job. I think this is one of the, according to Bible scholars, this is the first book that was written by Moses, even before Genesis and Exodus, which is really a sign as to, that a lot of the big questions in life are answered there. Why are these things happening? Why all of this pain and trauma if there is a God of love? And that first book actually really helps to see behind the scenes on some of those things. But Job, speaking of Job's losses, what were Job's losses? Yeah, the first thing he lost was what? Yeah, his wealth. He lost his businesses. And he obviously was a very good business person and had good relationships with his employees, but he lost the life of all of his employees. And now that we know who was in charge of doing all of this, we can probably figure out that the employee that was probably the most problematic was the one that was actually spared to tell the story. And so, and there was no insurances back then, so losing all of that, and then losing his children, losing his health, and constant pain. And in this imperfect world, life is going to be unfair at times. We live in a messed up world. And when we demand the world be fair 100% of the time, we actually hurt ourselves in those demands. We need to recognize that in this imperfect world, life is going to be unfair at times. And it's okay not to know why. Job didn't know why when it was happening to him. And even Christ, when he was on the cross undergoing his losses, asked the question, why? Why? And no answer came back. So it's okay not to know why. But we don't want to jump to conclusions. This is the part that is the most problematic, when we actually start to make assumptions, start to mind read, and start to jump to conclusions. And this can end up hurting us even further. So definitions. Grief is an emotional reaction that follows the loss of someone or something of great value. And mourning is the psychological process that occurs when you experience loss. And what we're talking about is actually a number of different types of losses. Loss of social status can be significant. It's easier to climb the social ladder than it is to go down the other way. And I remember actually in my earlier days when I was just starting to get involved in mental health, I was working in an ICU, and I had to go down to the emergency room and admit a a gentleman who had attempted to end his own life. It was actually a hanging that had gone bad, but he was still unconscious, and when he reached the emergency room, we didn't know if we were going to be able to save him or not, but we had to take him up to the ICU. But fortunately, he was able to get his brain supply back, and he was able to survive that. And so we went into, of course, asking what had happened. And this was the guy who had actually sold more cars in the city of Ardmore, Oklahoma, which was where I was the ICU director, than anyone else. In Middle America, I guess you guys are Middle America. I don't know if it's this way in Minnesota. It probably is. What is the number one selling vehicle in Minnesota? Is it American or not American? Not American? Okay. Well, in Oklahoma, it's American. And so it's, American cars are number one, and the Ford dealership was number one, and he sold more Fords than anyone in Billingsley Ford. So much so that the Ford Motor Company sent him on a free trip to Maui, and he had built a nice house, and he had gotten a new honey, and he was on top of the world, and he was, just really seemingly enjoying life. And I don't know what had happened. It wasn't my job to figure that out. But when he came back from Maui, he walked into his Billingsley Ford office on Monday morning, and he was escorted out. He lost his job. And they took his keys and told him to clean out his office, and they supervised him as he was getting out of there. And it wasn't like he had something to fall back on. And this was he had a great source of income doing this. And pretty soon he realized, I'm not going to be able to pay for this nice house in this wealthy neighborhood, and I'm going to have to give up my house. And then his honey was no longer interested in being with him, and all of the wealthy friends that he had developed, they weren't interested in being around him anymore. And he ended up, as a result of this loss of social status, thinking that life wasn't worth living, and then decided that he was just going to end his own life. The loss of a body part is something that is a very significant loss. And of course, if you look at some of these losses, like loss of ability to maintain a physical function as we age, that can happen, and probably will happen if we live long enough. And so we have to know how to go through losses. In fact, studies have shown, speaking of that, studies have shown how healthy you are, particularly post-60. I actually give a lecture called Life Begins at 60. If you're healthy enough, if you maintain your health, studies show that 60 and above is the happiest years of your life for a number of different reasons. But part of being able to get that to that level of happiness is to know how to undergo losses. Let me give you an example. There was a 100-year-old woman who came to one of my health seminars in Texas. This is after we had written our book, Proof Positive, and it was on a lot of the internal medicine diseases. And they had heard about us from East Texas, so they had a big health summit there. And so we were giving a series of lectures. And this one woman from the community, 100 years of age, came on her own power and was writing notes about this, about how to maintain her health. And she she wasn't out a lot, but of course word got out, and she had just turned 100 the week before. And so the news media found out about it, and they decided to come there at lunchtime and give her a cake with 100 candles on it and have her blow out this cake. And so they had a little birthday celebration, and right afterwards the media anchor puts the microphone under her chin and said, "Tell us, ma'am, what's special about being 100? And she right away said, "No peer pressure." And I started thinking about that, and I had a chance to talk to her afterwards. I said, any of your really close friends at age 40 think of all the friends you had at age 40. Any of them still around now? She said, no, not one. I said, how about 60? She says, most of them are gone, but there's like one. She had lost children to diseases of old age, and she had lost spouse, of course, children. So all of these losses, but yet she was able to still maintain her health in a large part because she understood a lot of what we're going to be talking about in regards to how to overcome loss and have disappointments become appointments. A loss of a job. That can be a significant loss. We've had people come through our program that lost their job like 18 years ago, and they talk about it as if it happened yesterday. They can go through every one of the details, and they can just, it's just all fresh in their mind, and they're still talking about it. A sign that they have not been able to heal from this. Loss of a home can be significant. Loss of a loved one, of course, is very significant. And of course, that loss of a loved one can be through death or divorce or separation. We've had a number of people come through our program that have actually lost a spouse due to death and another spouse due to divorce. I've often asked them the question, which one was harder for you? Anyone want to guess what answer I've gotten without exception so far? Divorce was harder. Death is terrible, particularly if it's a loving, close spouse, but divorce is even harder, when both of you are committing yourself until death do you part, and then can't live with each other anymore. That's a significant loss that we often don't have the compassion or sympathy for. And then often it's not really loss of those things, but it can be loss of a vision. This is where you just knew something was going to happen. It was just going to turn out this way, and you realize, no way, no how. It's not going to happen. And then we're also going to be talking about types of trauma that need to be healed from. The trauma of rape. This has become so common. We have never had a residential program, and we only take 20 per program, but we've never had a residential program where rape is not part of the background of at least someone in that program, and often it's multiple individuals. Murder of a loved one. We've had individuals come through our program where their loved one was murdered right in front of them. Suicide of a loved one. This is a trauma that you will live with the rest of your life if a loved one commits suicide. And this is also a deterrent, a wise deterrent. I've had many individuals say, well, I would have committed suicide except I didn't want to do that to my loved ones. Is that a good reason not to? Absolutely. But we also know others that did it to harm their loved ones. That's also very unwise and, of course, an unloving thing to do. But it is, these are traumas that many are dealing with, and as I mentioned, suicide rates are higher than ever before. They've gone up 20 years in a row now. Being traumatized continually by a family member or partner. This is what we call complex PTSD, where it's just a long-term traumatic aspects that you're having to live through. And then traumas of like flunking out of school and other unfortunate events. And sometimes we have to have these events in perspective because I practiced for 26 years in Ardmore, Oklahoma, before moving to California, and we would have to treat scores of individuals from the trauma of the Dallas Cowboys football team not making it to the championship game. And, I'd have to ask these individuals, does your brother play on the squad, or, is your dad the coach? And No, they don't have any relatives that are on the club, but boy, they talk about it as if they're their best friends, and they know everything about them, and they're just totally traumatized. By the way, this is one of the reasons why you don't want your team to actually go to the Super Bowl. They've actually studied this out. The 2 Super Bowl teams that make it to the Super Bowl, and in professional sports, this is what a lot of people don't figure out. In professional sports, any team can lose to another team, and it's going to happen. And so, but the team that loses that Super Bowl, the death rates go up in that city significantly within 24 hours. And there's traumatic deaths, and there's people that are drunk driving on the way home and are angry and upset and those sorts of things. And it's always, my team should not have lost. And they don't understand that term should, because all the ingredients were there for that team to lose. Otherwise, they would not have lost. And so, yes, those ingredients had to be there. But nonetheless, this is traumas that we sometimes have to treat and deal with. And then, of course, this is why the CBT portion of things that we'll talk about here in a little bit are very important. I remember when I was going through medical school, I was told that after you have a loving spouse and lose that loving spouse, it's going to take you a year to really regain things. Actually, this was studied more carefully afterwards, and widows and widowers are less likely to regain the same level of happiness they had during their married years, especially if their marriages were satisfying. Most people who lost a spouse but did not remarry took how many years to recover emotionally? It's 8 years. This is very significant. And it's actually even more significant the older you get. One of the things I've realized, and I'm blessed with a very loving spouse. We've had a great marriage for 36. It'll be soon our 37th anniversary. And it's what I've noticed is when someone does lose a loving spouse, if they're younger, they tend to get more sympathy and compassion than if they're older. And of course, if they're older, you think, well, they've been married 50 plus years and they've had a great life, and I'm sure they have a lot of great memories. But, it's actually harder for someone like that. And often you're more dependent on each other when you're older as well, and so you're much more likely to end up isolated and in a nursing home. And you also have more emotional loss and pain through that process than someone who's 30 years old and loses a spouse through accident, where there's a lot more opportunities for recovery. And so when thinking about companions gone, says Sir Walter Scott, we feel ourselves doubly alone. Lillian Hellman says lonely people and talking to each other can make each other lonelier. And so it gets back again to looking at our beliefs. Some beliefs are legitimate and will lead to negative feelings. So cognitive behavioral therapy is not just positive thinking. It's actually rational, more healthy thinking. So see if you can see the difference. I'm losing an important part of my life. If you've had a significant loss, is that true or is that false? It is true. How about this? My world has ended. That's false. And when you actually say those words, you're believing those words. I can't live without her. The person is actually living as they're saying the words. But this is a belief that will actually result in greater sadness, anxiety, and even greater loneliness. How about this? I will miss the companionship and love that we shared. That is true. It's desirable, and to even say that will enhance your humanity and add depth to the meaning of life. I will never again be happy because she or he died. It's unfair. That triggers thoughts of self-pity and hopelessness, and these thoughts are based on distortions and will defeat you. So, just like when a bone is broken, we have to have it set in the right way to go through the healing process. The grieving process is required for healing. And a lot of people just try to avoid that grieving process. When I was working a lot in the ICU and in hospitals and was spending a lot of time there, I had to pronounce a number of people that had expired, and often the families would be there, and I would often ask the families, is there anything I can do for you or anything I can answer for you, and try to help them through that process. But very often I would actually get asked, can you give us all a prescription for Xanax? Can you give us all something to just basically take the pain away? And that actually is going to very much complicate the grieving process. It's actually not going to be healthy for the grieving process. So before we go through a healthy grieving process, first of all, the stages of grief that virtually everybody goes through. Stage 1 is the stage of shock and disbelief. And this is particularly when the loss is sudden and unexpected. By the way, does anyone recognize that picture? Yeah, it's from 9/11. And we were actually the first team invited in to New York City after 9/11. We put on the first public grief and depression recovery program. And if you look at the 9/11 memorabilia, if you go on their site, you'll still see the program and the brochure and everything that we put on there. They found out about us because we had been there just a few months earlier. Oh, thank you very much. And we had also helped out in the Oklahoma City bombing since we lived in Oklahoma, and so we had been involved in that. Thank you. And by the way, that was where there were a series of losses all happening at the same time. You had loss of loved one, you had loss of home, you had loss of job, all piling up on each other. And that is kind of like war, that the war will do that. And so war is where you're going to have all of these super complex and terrible losses. But the first stage, the events seem unreal, like it does to those people that are looking at it. There's a feeling of numbness that occurs, often a denial of the loss. Many of the individuals who went to that program of ours, as we were talking to them and getting to know them, they'd said, it was like I was watching a scary movie. In other words, it didn't seem real to them. They kind of have to pinch themselves that this is actually happening. And there can often be crying and anger and even screaming at this stage. It's actually best that stage 1 be as short as possible. We'll talk about how to get through that more quickly here in a little bit. But stage 2 will then develop, and that is where you're aware of the loss. This is called developing awareness. It'll last from 3 to 12 months normally. At this point, you're preoccupied with the loss, meaning you're thinking about it a lot. Anxiety can often happen, and restlessness and difficulty sleeping. But other possible characteristics that can occur is loss of appetite and even digestive problems, nausea, fatigue, and of course anger regarding the events and the other situations that brought this together, and then often guilt as well. And then, of course, you're developing a clearer awareness of the loss, recognition of the consequences of the loss as a result of having to endure through it. Mood swings can also occur. But the good news is, if you're going through it healthfully, although long in duration, you should gradually feel better. Does it say day by day? And it doesn't even say week by week, but it says month by month. So you want to evaluate yourself month by month through trauma or loss. If you're not improving, that's a sign that you're going to need help. Stage 3 is the stage of resolution. This is where disappointments can often turn into appointments. And this is when you incorporate new habits, lifestyle changes can occur, and you begin to make wise plans for the future. And you gradually take charge of your life through resolving the loss, through activity, readjustment, and education. An interesting study was done a few years ago showing that 40 men whose immune systems were already compromised after they experienced loss. Actually, it was already compromised before they experienced loss. So they all had an immune system problem. They were studied from 4 to 9 years after they had experienced tragic loss. And grief over the loss of a loved one is often followed by introspection and a reaffirmation of life's worth and meaning. 65% of the men had engaged in a thoughtful consideration of the meaning of their loved one's death. And this is actually a good thing. You want to go through cognitive processing after a loss or trauma. This type of reflection can lead individuals to different conclusions, however. And for one group, their loved one's death only emphasized the negative aspects of life. How do you think that group did? Not good. Group 2, others simply accepted the death after doing this and moved on. How do you think they did? Actually, in this study, they did no better than Group 1. Others, the demise of the loved one led to them to a newfound respect for life and a commitment to significantly improve their own personal life. How do you think that group did? Compared with other subjects, men who discovered this new meaning in life showed significant improvement in immune function. This is why we say disappointments can turn into appointments. Their immune system actually improved through this process over what it was before the loss. The group also showed a significant advantage in long-term survival compared with the other groups. So this research demonstrated that this newfound sense of purpose can boost the body's immune system as it bolsters the spirit. So it's important when we go through losses and traumas to recognize our life is not ended, put the loss in perspective, and then ask the question, what can I learn from this? And where am I at for the task of healthy grieving, which is what we'll discuss next. As I mentioned, healthy grieving is not something we experience naturally. And that means the grief process to be done appropriately needs to have tasks. Tasks imply there is work to do, but this is actually empowering to the mourner who feels so helpless. Often we feel like there's nothing that we can do, but there are things that we can do. Sometimes I've heard a lot of people say, well, just give it time. Time does not always heal wounds, but working through them over time can. So if we work through them in the right way, we can actually have time work for us, because over time we can heal. So the first task is to accept the reality of the loss. Let me give you an example. When I was still in Ardmore, Oklahoma, there was a woman who had gone through our community program, and I know some of you have gone through the community program or facilitated that program. And she was a patient of ours at the clinic, but as a result of going through that community program, her depression went away, her anxiety went away, and for the first time in her adult life, she was off medications. No depression and anxiety. And she had been off these medicines about a year, was doing well, very well at the year point. And then tragedy struck. Her only biological son, 19 years of age, was found dead in bed. And he had lived in a separate apartment. He wasn't showing up for work. He was supposed to work at a tire factory that's in Ardmore called Michelin, and he didn't show up. And eventually word came to her that he wasn't there, so she was the only one who had the key to his apartment. So she goes into the apartment, and there he is, in bed, but gone. And she calls the paramedics, and they rush over there. They're there within a few minutes, and the things are starting to be turned upside down as they're starting to do CPR and things like that. But then the head paramedic says, wait a minute, let's look at his temperature here. It's really cold. He's been gone for a while. And so they called, stopped the code, and she was absolutely beside herself. She comes into the emergency room that afternoon, and I'm actually doing some scope procedures. And for those of you that work in a hospital setting and understand HIPAA, when the doctor's hands are tied up, they'll put it on speaker. So it came to speaker, and the ER doc is saying, I've got this patient of yours in the emergency room. She is totally out of her gourd. She doesn't know which end is up. Her son apparently was found dead today, and she thinks he's still alive and that you're going to save him, and that, I just need to load her up on a lot of IV lorazepam and admit her to your service. Will you accept that? I said, no, I don't want you to do that. And then he gets a little huffy. He says, well, what do you want me to do? I can't deal with this down here like this. I said, just keep her there for a few minutes. I'll have someone over there to help. So it turns out the individual who had facilitated this program worked in our office that Teresa had gone through, and they had become very close in the process. So Paula comes over, and we were right across the street from the emergency room, so it took her less than 5 minutes to get there. And so she walks into this ER room after having identified herself as helping that particular patient. And indeed, Teresa is out of her gourd. She is stating the very things the ER doc stated, and she's even saying other things that indicate that she's really having issues. She's also having some screaming episodes. And she would say, Dr. Nedley is going to save him, right? Dr. Nedley's an ICU doctor. He's going to save him. And it sounds cruel on the surface, but Paula would just say calmly, no, Teresa, Cody is gone. How do you want Cody to be remembered at his funeral? And she would talk about all the things she liked about Cody. And then she would go off and say, yeah, but he's going to Oklahoma City. I think they're going to save him up there. Yeah, he is going to Oklahoma City because we don't have a forensic lab, and they don't know why he died. And so he is going to be going to Oklahoma City. But tell me, what do you think? How would you, what would be things of way of honoring Cody at his memorial service? And so then she would start talking about Cody again. And the process itself only took about 20 minutes. At least it seemed that way to me, because very short order, this ER doc is back on the phone and said, I don't know who it is that you sent over here, but she's oriented. She knows which end is up. She's calmed down, and I'm wanting to go ahead and discharge her. And I said, go ahead and discharge her, but make sure she comes into my office within a few days. And so that's what happened, but we do have to communicate about the loss. Even having a mourning ritual is part of the healing process of accepting the reality of the loss. Well, 3 days later, Teresa ends up in my office, and she's now having the next set of issues. The police are coming to her and asking her about all the details in that room and what she found before she came into his apartment and all of these different details. And she says, I can't remember all of this. I mean, it was just so shocking. And of course, this is what happens with trauma. Often our memories about the details are foggy and unclear. And I told Teresa, I said, you need to write about your loss, and you need to write about it like a journalist. Just stick with what you know are the facts. And that actually comes from a study that came out of the Oklahoma City bombing, showing that those who wrote about the loss and journaled it had far less likelihood of later developing PTSD. PTSD is when there's triggers in the movie reruns. But when you already have it journaled, you don't have to go over it in your mind and have that movie continue to go through. So I said, just journal it and then set it aside. And when the police come, then you bring that out and have them read it. So you don't even have to read it. Just give it to them and read it and say, do you have any questions that I can clarify for you? And she did that, and with good, positive results. So, of course, this means working through the pain. It doesn't mean avoiding the pain. And self-care is important during this time. When people go through losses, I see them, because of their insomnia, just no longer worry about sleep hygiene or even try to follow any kind of sleep regimen. Their diet goes out the door, and they start junk fooding it, and they quit exercising. And is this going to help them through the process or hurt them? it's going to hurt them further. So it's very important. Sleep, balanced diet, exercise. Continue to exercise through your pain and trauma, and also maintain social ties. A lot of people drop out of their entire social existence, and except for maybe social media, which is not a necessarily healthy way to do it. You really want to have that face-to-face interactions. And studies have shown poor social support to be more closely related to later depression than a history of torture. It's also been shown to be important to maintain spiritual ties. Often when there's losses and traumas, who is it that gets blamed? Yeah, even the insurance company states that when you've gone through a loss, that it's an act of what? It's an act of God. And so we have a tendency to, not understand the perspective of the book of Job, for instance. And so we tend to lash out at things spiritually. And studies show that if you continue church attendance and spiritual ties and devotions, you actually do a lot better. And then watch out for nonsense arguments. These are things that will develop during your loss. If only I hadn't had that accident, I would be able to walk today. If I had left just 5 minutes later, it wouldn't have happened. Those sorts of things that go into our brain. And we call them nonsense arguments because it doesn't help the situation at all at that point. And then also we really don't know what would have happened if we'd have been 5 minutes later or whatever. It could have been worse. We really don't know. But we need to use task 2, use that opportunity to develop more patience. Patience is something that has been shown to be a significant, healthy character strength to develop. And when we don't have losses and traumas in our life, we actually have far less opportunity to develop things like patience. The definition of patience, according to Rogers Dictionary, is our capacity to endure hardship, difficulty, or inconveniences. How? Without complaint. The American Heritage Dictionary defines patience as the power of suffering with fortitude, uncomplaining endurance of evils or wrongs as toil, pain, poverty, insult, oppression, calamity. And the scriptures state, run with patience the race that is set before us. So it's something that we're encouraged to develop through life. Task 3 is to emotionally relocate the loss. Now this is important. A lot of people don't understand this part, and it really has to do with what we're called upon to deal with in life. We are called upon to deal with problems, and I like to divide problems up that happen into 3 kinds of problems. There's the practical problem, and that is something that happens that makes it more or most difficult for you to achieve your goals. And of course, this can be losses, or it could be traumas, where things actually occur where now it's even a lot more difficult for you to achieve your goals. Along with a practical problem, virtually always comes an emotional problem, however, and that's your emotional reaction to your practical problem. And then there's a third type of problem I call an imagined problem. And that is, it does not really inhibit you from achieving your goals. You're just upset of the idea of the situation. We actually have a lot more people dealing with what we call imagined problems. Not that they're not real problems, but as far as them not affecting them. I'll just give you an instance of this, in regards to politics today. But we had an individual come through our program a couple of programs ago, and he was just so angry about what President Biden was doing with the country. And so just, really upset about this and about that and all of this sort of things. And so, I asked him, I said, out of the things that President Biden has done, I'd like you to list out the things that have made it more or most difficult for you to achieve your goals. And he looked at the list and he started talking about gas prices and how that will, that makes it a little more or most difficult. And so actually when he got through this list and we're looking at this, I then got out these 3 sets of problems. And he had to admit, it hasn't really inhibited me from achieving my goals. I'm still able to travel where I want to travel. I'm still able to do all of these things. I'm still able to do all of this. But I'm just upset of the idea of the situation. And 2 years earlier, we had a guy coming through the program that was very upset at Trump and all the things that he was doing. And the same thing with him, it was a little easier to deal with, because when we went through it, I said, so how many things have Trump done that have actually affected you where you cannot actually achieve your goals as a result of that? And after looking at it, he says, well, really nothing, but it might. It might. And so, so this is where we don't need to be spending a lot of emotional energy on these imagined problems. But what if it actually is a practical problem? What if it is something where it does make it more or most difficult for you to achieve your goals? It's actually healthier to deal with the least number of problems at a time. And so we recommend at this stage, when you can go into the task 3, I will have this really bad problem, whether I'm miserable about it or not, so I might as well do what? Give up the misery. What does this do? It actually helps us to feel better towards calm, and it helps us to be in a better position to do something more intelligent about it. When we are calm is when our frontal lobe works the best. And this is the area of problem solving. This is our ability to look into the future and to be able to make wise decisions for the future. But when our emotions are all bent out of shape because of a practical problem that occurs, we're actually going to make it a much longer, if ever, healing process. And then in the process of all this, we need to know the difference between needs and wants. We get so many people confused about this. And many times, I could give you examples, I won't go into it, but many times it's even individuals that get suicidal because they think their want is a need and they're never going to get it again. And so sometimes I like to give them an example of having a very wonderful pen. I actually have had a problem through my years in the hospital. This is one of the advantages of the computer system. The doctors used to have to write everything, and I always had nice pens to write with, but I was always losing those pens. And I'd lose it on the nursing floor, and I'd go back to that floor and say, has anyone seen my pen? And no one had seen it. And even the next day I'd go there, did my pen show up there? No. And I realized that I was never going to find that pen again. Did that make me depressed and suicidal? No, because I realized even though it was hopeless that I would ever find this pen. This is one of the things we have to clarify. When you read psychological textbooks, it'll tell you that the most imminent pathway leading to suicidal thoughts is feelings of hopelessness. It's not quite true. It depends on what we're hopeless about. And since I was hopeless about never finding this pen, I never got depressed or suicidal, nor have we ever treated anyone in my program who's gotten depressed and suicidal over losing a pen, because they recognize it's a want. It is not a need. But what is it that we actually need? We need air. We need food, not even every day. People that come to our program and fast, they realize they actually didn't need food as much as they thought they did. We need water. We need, some people will say shelter. In the wintertime in Rochester, I would say that's true. But it's actually not shelter, it's sufficient warmth is really what we need, because there's a lot of people that live without shelter and do fine because they have sufficient warmth. And so when it comes down to it, there's very few things that we need. In fact, how do you tell the difference between needs and wants? You just ask this question: how long can I go without this before I die? If it doesn't affect that, it is actually not a need. It's actually a want. And by the way, I should tell you, maybe I will tell you a story of a 19-year-old girl that came to our program, and she had tried to commit suicide multiple times, but 2 times in the last few weeks in Cancun. Actually, it was within a week in Cancun. And she had gone down there with her boyfriend, and that boyfriend, who was the head pharmacist, who had a 6-figure income, when she started going through his phone, she realized that she was not the only one, and she saw another pharmacy technician there. And this girl from 13 to 19 had a lot of emotional issues. And it turns out the emotional issues, she had a very promising first 12 years of life. Everyone thought she was just the greatest young girl and was just going to do so well in life. But then at age 13, she was abused. And then repeatedly by a friend of a family member, sexual abuse. And there's different types of sexual abuse. We won't go into all of that. But the type of sexual abuse that she had led her to go from one boyfriend to another, one relationship after another after this abuse ended. And so she thought that she had a need to be in a relationship and to be in a sexual relationship. And I remember when she first came to our program and we started to get to the core of where her thoughts were about this. By the way, the first time she tried to commit suicide, she took a bunch of her psych med, went to the Cancun hospital, and they got that out of her system and reversed it and released her to her boyfriend. Had anything changed? No. And of course, she looked at her other bottles, and then one of them was a mood stabilizer that's also an antihypertensive, one of the best ways of lowering blood pressure, but she didn't have high blood pressure, and so it went down to nothing when she took that whole bottle. And then she ended up there for weeks, and he left her and went back to the U.S. and broke up with her. And she's down there all by herself, and her aunt hears about the program, and so takes her over to the program. And she said she wouldn't try it there, that she'd never been to anything like this. She'd been in psych institutions before. But the nutrition, the lifestyle, all of those things began to help, the light therapy, the good sleep-wake aspect of things. But we had to get to the core of the issues on the CBT part of things. And I had to explain to her that lack of sex is not a cause of death. It actually is not listed as a cause of death. And in the U.S., you actually have to put what caused every death. There's a death certificate that's filled out. What caused the death, and then what caused that, and what caused that. So it goes down to 3 layers. And I said, I actually have to look at all those death certificates every year because I teach a class at Weimar University called Principles of Health, Lifestyle Treatments of Disease. So I look at all those death certificates, and no one has ever put lack of sex as a cause of death. And so she kind of looked at me, and then she kind of smiled, and then she says, really? And and then she got it as a result of the therapist also working with her. We actually had to tell her that this is the time. In fact, it's very clear, to be happily married, you first must be happily single. A lot of people think the ticket to happiness is getting an intimate relationship, but that's not the ticket. The studies show within a year of that relationship, you're going to be the same level of happiness before you tied the knot. And so she needed to be boy-proof. And so we even had to tell her how to dress to be boy-proof so that she could work on getting herself very healthy. And she actually followed all of those recommendations. She didn't have a boyfriend for another 3 years after that. She became very mentally healthy. And then her frontal lobe was working so well, she actually chose a very good guy to get married to, and they have children today. And she's actually been interviewed by a media company in regards to how bad her suicidal thoughts were and depression and all of that from age 13 to 19, and then what happened afterwards. So keep those needs and wants in perspective. There's no use getting severely depressed over not having our wants met. So to emotionally relocate the loss doesn't mean that the loss is forgotten. Some people say, well, this is where, and that's actually accurate. We might emotionally relocate it by saying it is what it is. Now let's make the best of it. But that means that it's not forgotten. Reminiscing helps. We can build on current or new relationships, develop new routines, find new interests, and continue old ones. And then task number 4 is to adjust to the environment with the loss. And that means identify the roles that the lost person or thing played in your life and see how these functions can at least best be met now, maybe not as ideally as before. And then you're ready for task 5, and that is to grow from the loss. Don't settle for just surviving. Honor the lost person or thing by growing from the loss. Reflect on what you have learned or gained through the loss, and let life become more meaningful. And scriptures also comment on this. We know that in all things God works for the good of those who love him. That does not mean that there's always going to be good coming our way, or there's not going to be trauma or loss. We're never promised those sorts of things, but we can actually grow from these losses, and it can end up being an appointment. And so it would be worthwhile in reviewing your losses. Have you grown from the loss? And if not, are there some ways to grow from the loss? And if you've gone through loss and trauma and you have feelings of worthlessness or suicidal ideation or grossly impaired functioning, those are signs you definitely need help, because those are not natural, healthy ways of grieving. Or if it's prolonged bereavement, such as, you being in a position where you're thinking of your job loss 18 years earlier and having that aspect of things. I'm going to skip through because of me telling that story about this poem. But I'd also like to bring up in regards to my own loss. In 2001, we were there in New York City helping the individuals through their losses. And we actually have a little film and some slides about that in regards to feeding them healthy food to get enough melatonin at night and all of those things in regards to the biochemical aspect of things. And a year later, I was going through a tremendous loss. My father had died unexpectedly, and my father was close to all of us in our family. There were 5 of us. But he was a great man. In fact, I owe so much of what I am to him. And he was also very objective. I could always call him up in regards to decision making, and he could help me with perspective on the facts. But he'd never tell me what to do. He'd say, keep those things in perspective, but the decision is yours. And, it's almost like I was calling up God to get this wise person to help me to have perspective. Well, a month after his sudden death, he actually died of Legionnaire's disease, which can kill a lot of young people. We don't know how he got it, but he ended up with ARDS and died on a ventilator in a hospital. And a month later, I'm still having a real rough time. I just can't get over the fact that my father is gone. And I'm actually attending church. I'm trying to keep the things that I've just told you about. So, I mentioned, don't drop off the spiritual things. So I'm attending church, and there's a friend of mine there who lost his father right around the same time. I said, Rodney, you lost your dad about the same time I lost mine. I said, how are you doing? He said, I'm doing pretty well. I said, I am not doing well. And I explained to him what was going on. And he said, you need to know a little bit about my father. He said, he was an alcoholic. He was not good at all to my mother, or to us kids, for that matter. He was a cranky man, and I feel bad for him that he's gone, but it was no real great loss for us. And I thought, would I have rather had a father like Rodney and have no problem at his death? Or would I have rather had the father that I had and had this terrible grief? I would have chosen the father that I had. And that's the other side of loss. The other side of loss is love. And it's the reason why we actually have loss. Because love is a voluntary act. And in order for us to love, we had to have freedom of choice and free ways of dealing with things. And that freedom of choice often results in bad choices that can result in the opposite of those things. But I'd much rather live in a world which has the possibility of trauma and loss and the possibility of love than to live in a world where there's no love, but we don't have to worry about loss. And so I had to take comfort. And how I grew from this loss, even though loss was not originally part of the equation, it was never meant to be, I had to recognize that I needed to get, one of the reasons why my father was such a great dad is he was close to God. He did have a devotional life. He had a communion with God. And I realized I need to get close to God so I can hear that wisdom that he was able to transmit on a daily basis. So we're told that there will come a time in which there won't be loss, sadness, or death again. We're told that the Creator will recreate. But in the meantime, run with how? Patience, the race that is set before us. Any questions? Comments? Thank you.
Thank you. We'll take just a short stretch break, so get up, feel free to stretch your legs, take a walk outside. If it's a beautiful day, go get some vitamin D. We'll be back here in about 10 minutes. Thank you.
Yeah, I'm trying to leave. There we go.
You all were getting started, and I was like, holy cow, maybe I should have signed on earlier, so I'm happy you're not starting right away. I'm going to turn my email off. We don't get interrupted. My name is Dawn Salem. I'm calling from sunny Florida. I hope you guys have some sunshine there today. Yeah, it's great. And you're Denise, correct? Hi, Denise. It's nice to meet you. Oh, that would be terrific. I know I heard you were in town not too long ago. Oh, great. Oh. Okay.
Can everybody please come in and take your seats? We'll start the next session.
So,
Okay, can we talk about that after this? Because I'm going to get confused. All righty. We all ready to get started for our next session? Yes. I have one lady who's excited about our session on passion. Who else is excited? Woohoo! That's what I want to hear. I want to hear excitement. This is great. So this session is about passion. Passion. And when you think of passion, what do you think about when you think passion? Do you think love? Say it again. Fired up and excited. What else? You do something you don't ask for a return. One more person. Energy. I love it. We have energy. We love it. Well, this part of our session, you'll definitely find some energy with our first guest. Our first guest is going to be, you can see how beautiful she is. So we're talking about passion, and what actually is passion? When I looked it up in the dictionary, it says intense want, desire, just wanting to do something without really knowing why, but it's just something that is ingrained in you. In other words, a lot of us just call it your why. Why do you want to do something? Why do you feel compelled to do something? And oftentimes, especially when it comes to our health and wellness, we kind of go, I don't know. Why do I want to feel healthy? Oh, why do I want to lose weight? Oh, I want to lose weight because, I want to look better in my clothes. That's a good reason. But what about the passion? Why? What is the big why? I want to lose weight because I want to be healthy, because I want to run around with my grandchildren on the beach. Sound good? I want to climb Mount Kilimanjaro. Okay, I really don't want to climb Mount Kilimanjaro. I'm afraid of heights. I want to go surfing in Hawaii. Are these exciting things? Require energy? Awesome. A statement of commitment. I like it. So our guest here today is Dr. Dawn Salem. Dr. Dawn, may I call you Dr. Dawn?
you can call me Dawn. I invite all my patients to say Dawn. You can skip all the formalities. We are all friends here. We are in this life together.
We are. I love it. So Dawn is she's a doctor down at the Mayo Clinic down in Jacksonville. She is in internal medicine, integrative medicine, and also at the breast clinic. This is amazing. She's an amazing doctor down at one of the most incredible places in the world, and the sun shines there a lot, which I'm a little envious of. Dr. Dawn is also a cancer survivor. She's also a heart transplant recipient. And she, at 365 days, 1 year after she had her heart transplant, she ran a marathon. Amazing.
So I still can't believe that, actually.
I have have to say that's one. As I was reading, your bio a couple of weeks ago, I was thinking, like, wow, this woman is amazing, and she ran a marathon.
Well, you know what I will say my secret is, I know I'm not ready to talk yet, but whole food plant-based nutrition, I'm going to say there's a lot that goes into everything that I came through, but the real secret to how that was possible, I know for a fact, was the whole food plant-based nutrition. I am 100% confident. So, but I'm going to let you keep talking. I get so excited about the nutrition side of it.
We love it. And so, of course, that was the additional benefit and excitement. Dawn is on board with lifestyle medicine. Yay! So, Dawn, we're talking about passion here. And obviously, you've been through some ups and some downs in life, more than most people ever experience. Explain to us, like, how do you go from being a resident in medical school to somebody who is a patient? And tell us a little bit about that background and kind of what got you through.
Oh, that is such a terrific question. And I, have been very blessed to get through many adversities in my life. But it is because life for me is about something so much bigger than me. It is because of that passion meets purpose, and it's just this incredible level of being fully alive, and vitality just like explodes and ignites. And honestly, as soon as I start talking with people, it's like, I get all your energy, I'm giving you my energy. And if I yawn right now, you're gonna yawn. So, when people kind of say, oh, she's crazy. And I know this group of people, we're all on board with the same thing because we have this interest, but there's some folks you talk to and you start talking about energy and they think, oh, this is kind of weird. But I say, if I yawn, you're going to yawn. There's some connection we have. So I really used my passion to meet my purpose, to learn acceptance whenever I heard bad news, and to just keep moving forward. But it was really unique. And I would say that it is my strong faith in God, or whatever your belief, something bigger than you. But for me, it's my belief in God. And the fact I had such love in my life from my family. And so it was really interesting. Around the age of 4 or 5, I aspired to live to be 100 years old. So when people would ask me what I wanted to be, I would say I want to be 100 years old. I want to be in a Smucker's jar so I could be on the Today Show. And so I started eating very healthy around the age of 4 or 5. My parents really raised us very, very healthy anyways, but it was just something that I was just driven to do. And so this started at a young age. So my why and my purpose was cultivated very young. I knew I wanted to go into medicine. And so I believe that, God kind of introduced me to these various paths all through my life to prepare me, if you may. And so by the time I was in medical school, when I was diagnosed with stage 4 cancer, and in fact, one doctor said I would have 3 months to live. I fired that doctor, by the way. But then my next doctor really upheld this holistic approach to living. I have always applied whole food plant-based nutrition. But I believe what the real take home here is whole food plant-based nutrition can be really overwhelming, or maybe a new exercise regimen can be really overwhelming for a lot of people, especially if they're used to eating the standard American diet or maybe being more sedentary. And so I love what you were saying, Denise, that it takes something to introduce us as to why this is important. And so for me, it was because I just had this insatiable desire to want to be there for other people and serve others. So I wanted to fight through those various challenges. So with stage 4 cancer, I want you all to know you do not have to be sick a day in your life. If a doctor gives you a diagnosis, or if you have a chronic disease, you don't have to succumb to that disease. It doesn't mean you need to be in denial, but I am a big proponent and advocate for acceptance and to avoid turbulence. So, I'll be honest, I have actually met some patients on a perfect diet that they were so turbulent over the fact they were on that diet and forgot their why, that they were struggling in their disease process. So this is about really a holistic process. That's why I love whole food plant-based nutrition, but I love it when it's paired with all the other pillars of lifestyle medicine. So it's not just about one thing, it's about really letting all those things blend. And so I think it's really important with what you said, Denise, about passion, desire, because for me, it just ignited this flame. And in my sickest days, I had a bone marrow transplant. My medical team knew it was very, very important to me. And so they had a bicycle in my room. So when I was in the hospital, I would wake up at 4 o'clock. I kept my schedule every single day. I was 26 years old at the time. And I would ride my bike. I didn't have to wake up at 4 a.m., but I knew I wanted to keep my schedule. I I would bring my own clothes into the hospital. I wanted to keep my own identity. I didn't want cancer to define me. I didn't want my disease to define me. So I would put bright colors on. Those are the kind of things that meant a lot to me. When I was diagnosed with heart failure, that was really challenging. And the why I got heart failure was a little bit unknown. You know, could it have been the cancer treatment, chemotherapy? Could it have been the radiation? I had a very large tumor in my chest. And so the radiation went right to the heart. And I was blessed to be able to have a child. So I was actually diagnosed with heart failure a few weeks after my daughter was born, which was truly a miracle. So, you know, it may have been this combination of things. But when I was given this diagnosis of heart failure and chronic disease, I did take a few steps back because I thought, wait a minute, cancer, I was kind of like, I can handle this. We're going to treat it. We're going to treat it aggressive, and I'm getting back to life. But then I got heart failure, and I had heart failure for 18 years. And I'm not going to lie to you, there were ups and downs, but the overall trend was up. High energy, up, vitality. It doesn't mean that there weren't times when I had to be very sincere and authentic and listen to those feelings of not being well, those red flags, and work with my medical team. When I got my heart transplant, that was my opportunity to really have life reignited. So, you know, I hope that answers your question. I don't want to keep on going on that one question because you may have more. So I'm going to pause there and see if you want to ask me another question so I can make sure I try to get everything in our limited amount of time here.
It's a truly amazing. Like what you've told us really is incredible, and I understand what you've done, and I'm really amazed because so few people can do that. But I think you're right. You had this why from the time you were 4. And so often, many of us, I'm sure, you know, we're 30, 40, 50, 60, and we're kind of going, okay, what's my why? Has your why ever changed?
I don't think so. You know, from a young age, it wasn't really about me and being, you know, eating a healthy diet and kind of those very superficial things. It was about being there to serve others and trying to give others that vitality. So I just loved people. I loved older people. I just am filled and I think blessed with tons of energy and just love and gratitude for what life has. And, you know, the other thing, and I think this is a significant one for me, is I was given many diagnoses that ended my life. And, you know, we're dying every day, we're alive, and COVID's taught us a lot about our mortality, but I'm not scared of dying. And I think a lot of people are. And all I know is I think the reason I'm not scared of dying is because I live every single day, every single second in a way that it is full and as fulfilling and meaningful to me as possible. Everything. So when I eat my food, I mean, I look at that food and I take pictures. My camera has so many pictures of food, it's crazy. I take pictures of produce, I just keep it on my camera. I don't ever share it. I share it sometimes if it's a really good picture. But this stuff just ignites me. It gets me so excited. So how blessed am I to get to work with patients? But that's one-on-one. So how excited do I get when I get to talk to a group? And even if just one person is maybe able to repurpose their current diagnosis into something that is okay, or accept their disease. For me, each level of adversity, I grew stronger. There is truth when it comes to post-traumatic growth. I built my resilience. And so I, you know, kind of joke now, I'm kind of like, I don't know, I think I'm Teflon. You know, it's like, nothing's going to take me down. But if it does, it's okay, because I lived fully. I showed love to all the people I knew. And I really want to leave a thumbprint for my time on earth to help others live that life. So if I had to go through that hardship to do that, to help others live a more seamless life, it's worth it, because I feel like I've been blessed to really get through this in a pretty seamless manner.
I love the way you say you said repurposing the diagnosis, because I think you're right. That is one of those things people either can manage it and accept it, or they don't. And I like the word repurpose because it really changes the whole thing. It isn't, it is, or it isn't. It's something else. It makes it something else.
Yeah, I agree. And I think that's a way to just keep your mind up and to keep your mind looking forward. And, you know, those micro goals, or maybe it's a big goal. Maybe make some, you know, your SMART goals along the way, but maybe you have a big goal. It was really exciting. You know where I was this morning? I did a 5K with 40 patients in mind.
That's awesome.
Some of the women were in the middle of breast cancer treatment. The woman I walked right next to, she has stage 4 cancer. of the breast, and she's on very difficult therapy, but she was out there walking in the hot, humid sun and loved every minute of it. You know, and so it's really amazing when we can try to take good care of our body. I think it just gives back so much to our well-being. And again, it's not being selfish. You want to show up for yourself. You matter. I had a mentor, Dr. Amit Sood. He was at Mayo Clinic. He taught me the most important thing. When the heart beats, before it can send blood out to the rest of its body, it has to keep 5% of the blood for itself. The heart must nurture itself before it can serve every other organ. Remember that. So always keep a little bit for yourself. Now, thinking through that a little bit more, the heart also beats 95% everywhere else. So we want to think about serving others.
Absolutely.
And giving back in our life. And I think that's why I just have such authentic joy, because my purpose really isn't just about me. It's about giving to these other people and then seeing them live. And for me to have 40 women that were out there, all of my patients at this time are women. I have had gentlemen, so I don't want to just say women. At this particular event, it was just females with breast cancer that joined me, because I don't have any males on my panel right now, but they were all full of life. It was so cool. I loved that event. I mean, my heart rate was going so fast. I was like, I think I need to go sit and calm down a little bit. It's just great. It's very, very exciting.
That's amazing. I mean, your passion absolutely shines through. Every time I have seen you on either on video, on your podcast, you are this amazing, energetic, authentic person who has a purpose. And what we were saying earlier, you know, one of the things somebody had said was, you know, to do things without expecting something back. And you really embody that. And we thank you. We thank you so much for taking the time in your crazy busy schedule in life. I know you had this event, you have family visiting with you, and we truly appreciate you for being with us and helping us to really start to understand what passion is and why we need a why.
Well, you know, it's interesting because it's interesting you say that, because I really wonder, in this exchange we just had, I think I very well got more out of what we just had than you may have gotten. And that's the truth. That's about when you fulfill your purpose, you get so much back in volumes that's truly what energizes me. So I'm going to have trouble sleeping tonight because of all of you, because this is such an energetic exchange. So I mean, I'm just tickled to be here. So thank you. It's really the highest privilege.
We appreciate it, and we appreciate you. And I certainly will look forward to seeing you next time I'm down in Jacksonville.
Oh, I can't wait.
Thanks,
Thank
Dr.
you.
Dawn.
Thank you. Are we good?
Bye. Thank you.
Thank you.
Is she something or what? And so, yes. Her last name is Buechiler. It's on your program, and so what? Number one, this exchange will be on the Lotus Health Foundation website. I think. Oh, sorry, Facebook. You're right. Yep, it'll be on the Facebook page. And so if you look under Dr. Dawn Buechiler, you can find her. There's a couple of podcasts with her. So we thought that Dr. Dawn would be a great way to help us start this conversation about passion. So obviously, Dr. Dawn has a lot of passion for what she does. But what if you're not really sure what your why is, or what your passion is, or what it should be, could be? Well, I'm really excited to introduce you to my friend, LuAnn Buechiler, who is somebody who helps me find my passion. LuAnn is a coach. She is a passion test facilitator. She's an amazing woman. Truly, LuAnn helped me to really, at a time in my life where I wasn't sure what I wanted to do, what my desire was, what my passion was. LuAnn helped me to find it, and 3 years ago, I launched Living Healthy List with LuAnn's help, because she helped me find my passion. So LuAnn, please join us, and let's...
Wow, does Dr. Dawn exude passion, didn't she? That's what she was here to show you, what life can be like when you're living your passions. How many of you would like more joy in your life? More fulfillment? Less stress and anxiety? Yay, both hands, right? That is what the passion test helps people to do. And as Denise said, I'm a facilitator of the passion test and the passion test for business. I only get about 20 minutes today to share with you, so we're going to touch on some high points. And I want to start with a discussion. What in the world does the word passion mean to you? You said some of them earlier. Say them again. It's okay. Energy. Enthusiasm. Desire. Fire. Motivation. Drive. Things that get you out of bed in the morning, perhaps. Love. Thank you. Love. Yes, ma'am. So that's sometimes why people miss it, because they're in this euphoria of feeling so good, right? But we define it in the Passion Test program is as those things you love the most. But in my work with the Passion Test, I dived a little deeper. And do you know that the definition of the word passion is to suffer? Passion of the Christ. Thank you, sir. Right? So I want you to think about that story of the Passion of the Christ. Why did Jesus Christ suffer and die on the cross for us? Because he loved us so much, he was willing to go through that for us. That's the intensity of love we're talking about when we're talking about your passions. And so everyone under this roof can understand that because we know that story. And that's what I want you to own about the word passion. That's how much you love what it is, that you're willing to suffer to it. Mothers in the room, do we love our children? Yeah. Are we willing to suffer for our children? Yeah. Yes, we do it all the time, right? My children are growing and independently on their own today and healthy and happy and successful. And when I was a single mom before and I was going through those struggles with my children, I didn't feel that passion. I didn't feel that fulfillment. It was now when I see them, I almost cry every time. And I go, I played a part in that. I played a part in developing who those children are and the great human beings they are today. That's the fulfillment that we seek in our lives every day. Would you agree? Yes. So why do you need to know your passions? So that you can identify when it's happening. So you can find that joy and fulfillment sooner, not wait for 30 years to find it, that we can find it in every day. We say your passions are like breadcrumbs leading you on your path to your destiny. Your passions are like breadcrumbs leading you on your path to your destiny. Actually, the subtitle of the Passion Test book, which is I'm certified in this work by the authors, is The Effortless Path to Discovering Your Life's Purpose. So the authors of this book use the word purpose and destiny interchangeably, and I'm not sure I agree. There's another word that gets thrown in there often, and that would be fate. Are all those three words mean the same thing? No, right? Right? Fate to me is just people making an excuse that they're stuck, that I don't have a choice, that this happened to me, not for me or with me. Would you agree? Okay. And what do people think destiny is? Anybody? You have no choice, she says. Is it a predetermined, preordained end of result? Some believe it's fate. Is it preordained destination? The only destination I believe in is heaven. The only destination I believe in is heaven. And so I'm not fighting to get there, really. I'm kind of enjoying this life. And so I went with the word purpose. And your passions are like breadcrumbs leading on your path to your purpose. They're information, emotional information. We were talking about emotional intelligence. It's emotional. It's this journey into here. I believe when we talk about destiny, it's our journey. It's our journey along the way. And our passions are clues to help us stay on the journey that God designed for us. To learn ourselves, to learn our connection with our Creator, to live along that path that we desire. Does that make sense? One of my favorite quotes from the Passion Test book is, "That which you love to do and what is God's will for you are one and the same thing." How cool is that? When I read that the first time, a weight was lifted off my shoulders. Like, even I don't have to do something to prove something to any of these people in front of me, or to my family, or to anyone else in the world. All I got to do is align myself with God's will for me. And he said, do what you love to do, not work hard to get ahead. He said, do what you love to do is in alignment with God's will for you. So much easier. We have a problem comparing ourselves to other people and trying to be like other people. We are not other people. We might have the same skin color, we might be the same gender, but we're still two completely different people. And our journey is our own journey, each and every one of us individually. And so understanding what your passions are so that you can stay on that path and live that purpose that God designed for you, that was his will for you, is what it's all about. And I say when you get connected to your life's flow, everything comes easier. And that's how I feel since I've been doing this work. And I started doing this work because I fell in love with the message. And honestly, I wanted to live my life this way, following my passions. And I knew if I taught other people, I would learn it myself, and I would live it more thoroughly and in integrity because I'm teaching it every day. And there's some days when I'm standing on a stage like this, and I'm talking about it, and I'll tell a message, and then I'll look up and I go, that one was for me, wasn't it? This is really for me. I was speaking it out to you. So in the Passion Test work, by the way, is anybody familiar with a program called the Strength Finder? Just a few. Well, the Strength Finder is a test that you can go online and take anytime you want. It's called the Strength Finder 2.0. It's about $25. It asks you a series of questions on whether you like that situation or not. And then after the test is over, it spits out your top 5 strengths, natural skills, characteristics, talents that you carry. Okay? I call that the scientific methodology at getting at who you are. I don't profess to understand how that test works, but I know that my top 5 are true about me, okay? And the Passion Test is not a test. It's a process that I facilitate people through to help them identify their top 5 passions, normally in a 2-hour coaching session or a 3-hour workshop. So I can't get you there today. I'm just going to inspire you to want to find yours. And there's other tools to do that besides the Passion Test, but it's the one that I promote. And the Passion Test is the heart and soul methodology of getting at who you are and who God designed you to be. When you put the Strength Finder and the Passion Test together, it's a powerhouse of knowledge of just God, who God designed you to be. And I tell people to go and live that. Just do that. Be who you are authentically designed to be. And you're different than everybody else, and that's okay. We talked a lot last night about your why, and the other book that I would recommend is Simon Sinek's Know Your Why. And when Simon Sinek came out with the book Know Your Why, I was like, he wrote a really good book about why your why is important, but he didn't tell people how to find it, and said the Passion Test was the tool to find it. Now Simon Sinek has a workbook that goes along with his book, Know Your Why, so that you can work through the process. And he says, you'll know your why when it makes you cry. You'll know your why when it makes you cry. So it took me a long time to accept my why, and my why is to provide joy to other people. And I align with the prayer of St. Francis. And being where we are today, I'd love to share that with you, right? Lord, make me an instrument of your peace. Where there's hatred, let me sow love. Where there's injury, pardon. Where there's doubt, faith. Where there's despair, hope. Where there's darkness, let me bring my light. And where there's sadness, let me bring great joy. And that I totally aligned with as my purpose in life, to do those things and bring great joy to other people. And I want other people to find theirs. This is why I do the work of the Passion Test, to help other people get fired up about their passions and their purpose in life. Then we talked something last night at dinner also about, I don't remember the exact words he said, but it was really for me about conscious awareness of the choices that we're making in our life and fully committing to being consciously aware of the choices that we make in life. Doctor, is the doctor in the room who said that last night in a different way? No, okay. Anyway, so for us, we do a little formula to be consciously aware of what we're choosing. First of all, the key to living a passionate life, by the way, is whenever you're faced with a choice, a decision, or an opportunity, consistently choose in favor of your passions. Therefore, again, you must know what they are, those top 5, so you can consciously choose every action in your day, in your life, in your week, in favor of those things and doing things in that area of your life. So we say you set the intention by clearly stating what you want to create in your life, by identifying your top 5 passions and stating them, right? So you've set the intention of what you want to create in your life. And then you must take action and pay attention to those things. So intention, attention, take action every chance you get, even if it's baby steps, and then no tension. It's a little formula, a little mantra that I remind myself of. Intention, attention, no tension. The no tension was the hardest one for me. Let go, let God. Let it unfold in its right and perfect timing. It's not your plan. It's somebody else's plan. We're co-creating together. We need to follow those clues, those emotional clues, the passions, and walk in honor, just like values. So when I use this in business, it helps businesses create core values. That's really what it is. And so it's walking in alignment with your values, leading you on your path to your purpose. Intention, attention, no tension. There's power in clarity. Clarity is power, in other words. And so we got to get clear on what our intention is, what we want to create in our life, and our passions help us do that. And then take every action we can in that direction. And don't just take the passion test once and never again, by the way. I call people who take it the first time the passion babies. And they start to understand the process. And then I ask them to live with the tools and the philosophies of the program. And then come back and see me again. And we do it again and again. I've been doing this work for, 14 years now. Denise, how many times have you taken the passion test? 5 times. Here's the deal. It's a journey of gaining clarity. Clarity is power. And so we go deeper and we go deeper is what happens. A lot of times when I start working with people, they come up with passions that are more materialistic, shall we say. And then they go, no, that's not really true, right? And by the way, your passions aren't these big, overwhelming things. They're often very simple things that we just want to honor. Like one of my passions is to be in loving, supportive relationships. In loving, supportive relationships. So simple, but so important to me. And then we do work to delineate out more what that looks like. We call them markers or evidence of what it will look like, that I can know that I'm living my passions. Make sense? And so it's all this getting clarity. And when you get to the point that you start repeating the exact same phrases come up as your top 5, what do you think that feels like? That those 5 always stay the same. Complete confidence, peace of mind. And when you're consciously aware that you're choosing in favor of those things in every step that you take in your life, what do you think that feels like? It feels easy. It feels joyful. You find fulfillment in every day, and it's not thunder in the clouds or anything, right? It's little things that you go, wow, and you find that joy in an instant. As easy as one of my other passions is to inspire others. And when I say that, and I write that down, and I talk about what it looks like when I inspire others, and anyone in you in the room go, thank you so much, I learned something, you inspired me today. What do I get? I get joy and fulfillment in my heart in the moment, right away. Right? I don't have to wait 30 years for it. I get it right away. So you want to know your passions, memorize them, and describe what it's going to look like when you're living them, so that when it happens, you absolutely know it's true. And it will happen way faster than you think. Because oftentimes we're already doing it, we're just not consciously aware of it. We haven't acknowledged it. We haven't admitted to ourselves that this is it. It goes back to a conversation also earlier about, and I think Dr. Dawn said it, about acceptance or contentment with where you are. We human beings always put ourselves in the struggle. It's called setting goals. And we set a goal, and we achieve that goal, and then what do? We set another one, and then we achieve that one, and what do? We set another one, right? And we're constantly putting ourselves in the struggle to get somewhere else, to be somewhere else, to be more, to do more, to have more, whatever it is. And none of it is what really matters. And what do we do to ourselves when we don't achieve a goal? We beat ourselves up. So in our work, we don't set deadlines on anything. It's all things in their right and perfect timing. And contentment with where I am now, and acceptance for where I am now. I spent the last 7 or 8 years caring for my mother. So my business wasn't getting my attention. And I didn't realize during that journey, because I wouldn't change a thing about caring for my mom, but I didn't realize how much that journey was weighing on my energy and my passion and enthusiasm for life. So thank you for the talk this morning. That really helped me again. What I need to do now is love my mother for being in the place that she is now and celebrate her being with Jesus Christ so that I can move on. And I know she's in a better place. And I've shifted my life in 2022. She passed away in July of last year. So a little off track there maybe, but it's just knowing what's going on in your emotions like he was talking about. And your passions are clues. And we get to own them and know that which you love to do and what is God's will for you are one and the same thing. And you can start this journey of intention, attention, no tension tomorrow morning or when you walk out this door. And you can set the intention for how the rest of the day will be in the emotion where you want to be. Choose joy. Joy is a choice. We can choose joy. Every morning when you get up, you can set the intention. How do I want my day to be today? I want to be in service to others. Excellent. And then watch yourself do it all day long. Guess what? I think that 95% of us are better. That's all we ever want, is to be in service to others. We learned the lack of community in the last 2 years, didn't we? We know how important community is to us. It was one of the great lessons, the silver linings that came out of this pandemic. And so be in service to others and watch yourself do it. Another thing we do with the passions, Denise is going to have to pull me off stage. Another thing we do with the passions is we score them. We evaluate where we are in life today. On a scale of 0 to 10, how present are these things happening in my life today? And we use it just as a baseline to acknowledge where our consciousness is in that moment. And then I'll give people tools to stay on track with living their passions. And then we score them again, maybe 6 weeks or 6 months later, to see if using those tools of conscious awareness and conscious choice have helped you to shift your life more in alignment with your passions. And I watch people all the time, and they score themselves so low because we're so hard on ourselves. And there was a woman in a woman's retreat, and the women chose to share their scores with each other. And her passion was about being in service to others. And she scored herself a 2. And every other woman in the room about came out of their chairs. They're like, what are you talking about? You're always serving all of us. That's all you do every day is serve other people. And she had given herself a 2. So it's great to have people around you who are living this same philosophy to help hold each other accountable, to see beyond what you see. Because you know what? All this judgment that we have, when we think of judgment, it's right here between your ears. It's not that other people are judging you. You're making it up and saying that other person doesn't like me or they're judging me. But that's right here. It's coming from right here, right? There's no judgment. Live fully, authentically who you are, following your passions. You will live more joyfully, you will have more fun, and you will attract people like that to you. It's the law of reciprocity. There was something earlier said about the law of reciprocity, and I work in an organization called B&I Business Network International, and we live by a philosophy of giver's gain. If you give of yourself to help other people be successful, you will naturally gain in return. Again, the law of reciprocity, and being in service to other people gives us great joy as well. And that's why a lot of people's passions come out with some service inside of them, that they want to serve others. Let's go to questions. I got way off track with what I was going to say today, but I believe that God always moves through me what the people in the room need to hear. So, any questions on what I've shared with you today?
Comments?
Thoughts? Feedback?
Questions, comments? Okay, I know you guys have been around for like the last 2 days. I know you have questions and comments. Please.
I got enough. My top 5 strengths? Number 1 is woo, winning others over. Number 2 is positivity. Number 3 is communication. Number 4 is responsibility, and I hated that one. And number 5 is strategic. And I thought, wow, I don't feel like I'm strategic, but I've really owned that since I got that one. The responsibility one, I was like, I don't want to be responsible. I'm fun, carefree, creative. And then I read the paragraph, and this is a cool thing about the Strength Finder, is that even if you had the same top 2 that I do and your other 3 were different, your paragraphs are going to read different. So even if we both had responsibility, your paragraph's going to read different than mine. And the paragraph said in the first 2 sentences, when you take something on, you give it 150%, you're completely passionate about it, and you never quit till it's done. I went, oh, gosh, that's me. That's you. That's me. Someone else had a question. So
I've
first of
actually
all,
never seen those days, and I've known LuAnn for a long time.
there's only one person that sees that state, and it's called my husband. Yeah, he gets the brunt of that I'm positive everywhere else in the world, and when I have a bad day, he gets that. That's true. Okay? It's about baby steps. It's about doing what you can with the resources that you have now in the direction of your passions. And the universe, God, responds and gives you more of that so you can take more action and more action and more action. And I find that people achieve where they're headed in half the time they anticipated because we're co-creating. It's like the proverbial light at the end of the tunnel. When I know what those top 5 things are and I know that I will get there one day, I can stay happy. We say that the ups and downs of life fail to throw you off track when you're following your passions because you have that guidance to come back to and get back on track, right? Family's very important to me. I had to take care of my mom. It became my priority. My business was in the background. Now it's my turn to go take my business to a new level, right? And that's okay. And I could get through that. What was that? Baby steps. Exactly. My friend Jack Canfield, anybody know who Jack Canfield is? Chicken Soup for the Soul series and Canfield Success Principles. He often says in his presentation, back up before I tell Jack's story, it's about faith, my friends. It's about having faith that it will unfold before you. And Jack says, we'll drive down the road even in the dark in a city state we've never been before, and we can see only 20 feet in front of us with our headlights, but we have faith that that road's going to unfold before us and that will take us where we need to go. That's the kind of faith you need to have in taking your baby steps in your passions, that it will guide you to where you want to go, and just keep going towards that light, that proverbial light. So back to my availability before Denise pulls me off the stage, I put some rack cards, if you will, information about my Passion Test workshops out on the little glass table to the left. and some bookmarks that have my contact information on them because I ran out of business cards. And there's a form there that if you want me to follow up and contact you and help you with your passions, you can fill out your name and contact information and put it in the little box cover that's out there, and I'll take responsibility for following up with you. And I would love to help any of you find your passions, your next step. Oh, and who was I talking to last night? About retirement. Skip the word retirement. Get it out of our language. Who wants to be tired again? Who wants to be tired again? Retired. No. What is the next phase of my life going to unfold for me? What is my passion now? I had the blessing of working with our 55 and over club when we first opened it, and I would go in and do my workshops on the passion test to practice. And I found that the people that were coming in front of me had been retired for 2, 3, 4, 5 years from their jobs at the world famous. You know who I'm talking about. And they're like, I don't have any purpose. I have no meaning. I'm bored. I'm lonely. I'm sad. I'm like, oh my gosh. We need to erase that word and help people. Yes, it's time. You've served your career purpose. Now what else are you going to serve with in your life moving forward? I love helping people like that with finding their next steps. I want to say one more thing, Denise, and I opened my folder, and what do I have in my folder? The Blue Zones Project. Who's familiar with Blue Zones? Excellent, right? It's what you guys are all talking about. They have 9 principles. You have principles around what you're talking about in lifestyle medicine, right? They're overlapped, they're similar. And just one of those is passion. And the Blue Zones also has a plant slant, is what they called it, moving naturally, all the good stuff. So, we're operating the same conversation.
Absolutely. Thank you, LuAnn.
Yes, my pleasure.
LuAnn Buechiler, everyone. Woo-hoo. And if you have other questions, because I know some of you do, make sure you grab LuAnn outside during the break. We're going to break till about, we're supposed to break till 4, but we'll give you guys 15 minutes. So we'll see you back here, and we're going to start at 5 after 4. Thank you. last 2 days, and I'm curious.
I need to get better at figuring out because I do a lot of things. So main thing is because I'm trying. So I'm on the Casablanca School Board,
Okay.
and we have a wellness committee. And we're trying to make this year bring in those plant-based options in our school lunches or on the wellness committee. Lots of ideas around lifestyle medicine.
Awesome.
But I'm mostly a musician.
Cool. What do you play?
Teach. I'm not in any performing band, but I do play drums once a month at Christ Community Church. My karate teacher suckered me into that. and,
Well, from what I understand from my husband who plays the guitar, is you can't have a really good band without a drummer, without a good drummer, so.
I was honored. She thought it was pretty good. But I have a music project for 60s emulations. It's been the past 2 years trying to
Fun.
get a good sound, how to make that happen. Because I love the 60s, but I love the cliche cleanness of
Yeah.
today's.
Interesting.
And I paint.
And paint.
I grabbed the wrong sweater today.
That's okay. I get it. Before you leave, grab my card. Check out Live in Healthy List. Let's talk. Because if you're talking, about, healthy lifestyle, obviously lifestyle medicine is a way to get people. But we talk about health, wellness, personal development, and fun in kind of a different way. So you might get some good insight. One of the things we're working on is workplace wellness. And those are things to do, that might be inspirational. You might get some ideas from that too. Okay. Yeah, just, yep. I feel like I should be entertaining you guys or something. You're watching me. The lady over there is watching me be silly. That wasn't part of my contract. I'm supposed to talk, not dance. Maybe I should have helped work with Dr. Chen with his talk yesterday. I could have been the dancer. I'm Denise. Yes. And yours? Jasenia. It's really nice to meet you, Jasenia. Welcome to Rochester. I know you've been here a year and a half, but welcome. I've been here 20. New York. I grew up in New York. I was there for 25 years. I lived in Philadelphia for a few years, and then I moved out here when I met my husband. Yeah, so it's been. I hate the weather. This is an amazing day. Most of the year, I just don't like the weather. And I will be one of those people like, oh no, it's not so bad, as I'm freezing. But I did learn, after my first winter here, I learned you need a really long, puffy coat and ugly boots. Forget style went out the window. Yeah. Yeah. I didn't even care. 20 years. Just didn't used to. No, just better clothes.
Really, that's a good point. You don't really get used to it.
Yeah, it's just you have better clothes. All set? All righty, we all set? Everybody come on back in. Let's get started. Was that a great session or what? Everybody excited about their passions now? That's good. How about our last break? Did everybody get a chance to go outside, get your vitamin D? Very important, part of our lifestyle medicine, health and wellness. So our last session for the evening? It's 3 o'clock in the afternoon. What am I talking about? Is the Nedley Depression and Anxiety Recovery Program, aka NDARP, and Optimize Your Brain, OMB, an update and testimonial. And this, of course, is with Dr. Neil Nedley. Dr. Nedley, please take the stage.
Yeah, we can do that. So, a little bit of background of how we got involved in depression and anxiety recovery. rates of depression and anxiety were going up in Ardmore, Oklahoma as well, where I was in clinical practice. And I used to teach in a residency program at Kettering Medical Center, and I used to tell my residents that they needed to learn the common diseases well. I wanted them to know gastroesophageal reflux disease as well as a gastroenterologist. Why is that? Because they were going to see that just about every day of their life. And if you're going to be seeing something commonly, you need to know it like the experts know it. I wanted them to know congestive heart failure as good as a cardiologist. I wanted them to know pneumonia as good as a pulmonologist. And at first they would cringe on these things because there's a lot to learn about all of those types of situations, particularly at an expert level. But everyone has come back and thanked me that have had an opportunity afterwards, because when those patients end up with cardiologists and pulmonologists and gastroenterologists, and the internal medicine doctor has been treating them on that expert level, those subspecialists all comment on it and say, you've got yourself a really good doctor, and there isn't really more that I can do. And so those comments go forward pretty readily. But I began to realize in my practice, depression is getting pretty common, and an article crossed my desk showing up to 1 in 3 people who an internal medicine doctor sees has major depression. And I had to ask myself, do I know this as well as a psychiatrist? And I had to admit that I didn't. And so I sat at the feet of preeminent psychiatrists in our community, learning more about their diagnosis, learning more about how they went about things, and learning their workups and those sorts of things, and their therapeutic aspects, and learned a lot about, of course, high doses and combination of medications, because psychiatrists are really experts at using a combination of psychiatric drugs and pretty high doses, and trying to avoid some of the interactions and effects and those sorts of things. But I did ask them. I noticed once diagnosis was made, then medication treatment came forward. And I did ask them, I noticed you don't do much of a workup to find the underlying cause. And they said, well, that's because there really isn't much known about the underlying causes. I said, well, I do notice that you rule out thyroid, you rule out some things like that, but it's not really that extensive of a workup. And I asked them, if I went to a medical library and searched for causes of depression, how many might I be able to find? And they said, maybe 8, 10, 12, but mostly the cause is unknown. So I did go to the medical library, and I began to search for definite, not guess causes, but real causes of depression and anxiety. And I began to get depressed myself when it was cause number 71, and I wasn't through yet. And I didn't realize it until then, but I was the first one to actually do a very comprehensive medical literature search in regards to all of the different causes of depression. After I got depressed at cause number 71, I thought, let's go through this list and let's start categorizing it. And I recognized that these 71 and then later over 100 causes that we outlined could be categorized into 10 different categories. And then I began to look at patients and try to find out which causes were operative in them when they had depression. And I noticed that they really wouldn't have symptoms of depression until they had 4 different categories going on. And so the nice thing about it is most of those categories could be reversed. And once they were reversed, the brain's pretty resilient. It can undergo 1 major hit or cause, 2 major hits or causes, 3, and still be functioning fairly well. But once you start attacking the brain 4 different ways, that's when it's going to start being compromised significantly enough for a diagnosable mental illness. And so as I began to utilize this workup approach and then began to implement this in my practice, we started seeing some amazing results. And what happened soon thereafter is, by word of mouth, these individuals were telling everyone else about what had occurred, and so pretty soon my internal medicine practice started to be pressured to become a psychiatric practice. And I liked internal medicine still. I liked all of the aspects of internal medicine. I remember one of my colleagues that was next to me where I was seeing a lot of the mental health cases. He came by one time and says, "Don't you wish you could see a chest pain right now?" Because, chest pain's a little easier to deal with than all of the other issues involved. And I had to admit that I would have rather seen a chest pain in that moment. But it was quite rewarding because of the results we were seeing. And then finally, my receptionist said, "Dr. Nedley, you can't see all of the depressed people in this town. You're only one doctor, and you're not going to be able to see them all. You need to be writing down what you're doing and what's happening." And so that's when we decided to write our book, Depression: The Way Out. And after that came out, that was able to help a number of people. But we also noticed a lot of people with depression and anxiety don't have focus and concentration enough to be able to read, much less apply what they're reading. And so we weren't able to capture as many people as we would have liked that way. And so that's when we decided to come out with a video series and a workbook series to make it easier for people to be able to implement the approach, see which hits were active, and then out of those 10 hits. And that's when we ended up developing the community education program. The Lifestyle Center of America, that was running in Oklahoma at that time, was filming their diabetes section of things, and they asked me if I would film the depression side of things, since they already had a setup and everything ready to go. And so that was our first filming series a number of years ago. That was about 2002, 2003 that first series came out. We've updated it significantly since that time, and we're just now starting to plan, and not just plan, but implementing now the update of it being significantly updated since that time. But then we started the residential program, because even the community program, although it has significant results, actually it does better than medications or traditional approaches, just that 8-week approach. And there's been well over 8,000 people now that have gone through that, and we have all of their data and before and after scores, and it's been on 4 continents. And so we get a significant response rate out of the community program, but it's not, it's more in the range of a 70 to 80% response rate, and which is, like I said, better than other approaches. But there's still about 20% of those individuals that are not able to be significantly helped just with the community series. And that's when we decided the residential program. Also, another issue with the community series is some people are too depressed to even show up for an outpatient community series. And they have so many other issues in their life that they can't really attend once a week or even think about implementing the attendance. So we started the residential program for those that had either failed the community program or were unable to access themselves to the low-cost community approach. And of course, that's when we started implementing other things that we had discovered, like doing epigenetic studies on everyone that comes in to see what genes they have, whether they're active or not, and then how we can deactivate those genes that are mutated genes that are associated with depression and anxiety. And that's produced a significant benefit, as well as being able to have professional counselors to deal with the developmental and adverse childhood experiences events, as well as the trauma events that we alluded to earlier on today, to be able to see where they're stuck in their trauma aspect of things. And then when we combine that with nutrition and lifestyle and all of the other things, it's pretty amazing what happens in that residential program in as little as 10 days. Well, after that series, when we had that all put together, one of the things that we looked at was the emotional intelligence of people going through our community program. And one of the gratifying things is that not only were people often leaving that program depression-free and anxiety-free, that had significant depression and anxiety, but their emotional intelligence was going up by a whole standard deviation when we looked at the before and after scores. And we thought, if this can work for depressed people and anxious people, what could it do for people that are not depressed and anxious as far as their emotional intelligence? And that is how we decided to put out the OYB series, the Optimize Your Brain series, which is not really for depressed or anxious people, but it's to really help develop their ability to learn, retain, and apply knowledge. So it's dealing with the IQ side of things as well as the EQ side of things. And it's a little shorter program than the depression and anxiety recovery program, and it takes them to the next level as far as being able to understand how to correct irrational thoughts into rational and helpful thoughts, as well as some biochemical aspects that can also improve our ability in both aspects of things, particularly enhancing the frontal lobe of the brain. Well, when some people associated with the Ninth Circuit were going to our emotional intelligence series and seeing what they were dealing with, there were people associated with them that recognized that perhaps putting together a K through 12 curriculum could help a lot of the challenges in the judicial system. I don't know if you're very well aware of this, but you know, we call these individuals that are being disciplined for their behavior, we put them in what's called correctional facilities. But they're not really very correctional. And they're not really enhancing their emotional intelligence, and they're not really enhancing their ability to be free of that place without repeating a lot of the same emotions and behavior that landed them in there. And so recidivism is also at an all-time high. You know, one of the things that actually is quite interesting in this, talking about the biochemical role, there's a friend of mine in California who's not a medical person, but he's a business person, and he had come across a lot of our material in regards to emotional health and diet, and he was actually, he won a contract. At the time, California was losing lots of money on their prison systems, and so he was asked, or not asked, it was a contracting out there to the private sector to run a number of California prisons. And so he actually won the contract, and it was paid a sizable amount, not as much as what California was losing, but the idea is we can lose less money by having the private sector do things that government has problems doing efficiently. And so as a result of his knowledge, he decided to do something that was pretty novel. He had the prisoners, when they were admitted to the prison, undergo a dietary nutrition lecture. And so there was a nutritionist who actually spoke about emotional health in relationship to diet, and then asked the prisoner, it was their choice, whether they wanted to be on the standard prison diet or whether they wanted to be on a plant-based diet, to see if it would help correct them. He didn't use that term, but correct their emotional part of things. And it was pretty amazing. Obviously, it was a very good nutritionist who was well motivated. Because I would think, most prisoners are going to say, hey, man, if I'm in prison, it's punishment enough to be in prison, but to be on a plant-based diet is doubly punishment. And so there's no way I'm going to be on the standard American diet. But actually, over 90% of the prisoners said, you know what, if this is going to help, nutritionist said it's not going to really sacrifice taste. Let's try it. I'm here in prison. I'm not proving anything to anybody. Let's just go ahead and be on the plant-based diet. And that section was a different section for those on the standard prison diet. And that section, it turned out, Terry Moreland was able to make a lot of money on. Oh, I just told you my friend's name, that's the business person. And the reason why he was able to make a lot of money on that side of the prison was because they needed far less prison guards to actually manage the emotional problems of the prisoners. And so he was able to save a lot on expenses. He said, these people are pretty docile and they actually get along and they actually, they're not after each other and they're not trying to kill each other and those sorts of things. And so, so he ran these prisons in this way and was making a sizable amount of money now. Instead of the prisons losing money, they were actually gaining money. And I don't know exactly, and I don't know that Terry knows exactly what happened, but, of course, there are people that are in the tax department of California that might be connected with those who are not in the tax department in the government of California. And I think they probably saw how much money Terry was making. And within, he got a 60-day notice that his contracts were being canceled. And California was taking over the prison systems again. So California took over the prison systems after several years. And as soon as they took over, the first thing they did was cancel that program. And the next thing that happened is they began to lose a significant amount of money again. And it was about a 4-year experiment, and then they begged Terry Moreland to come back and take over the prisons again. But he had moved on in his business things, and he didn't trust California anymore because he had invested a lot into this, and he said, I know what you guys did to me last time. You're not doing it to me again, and I'm not doing this. But it actually was a nice study, and you can actually read about that study, and that's part of really helping people emotionally is to even know what to put into their diet and eat. And so what you have on the screen, interestingly, of course, the Ninth Circuit isn't really California, it's the federal system, although it's over that federal system. But this is something that the Ninth Circuit actually had us develop for the K through 12. So this is just, we're dealing with a lot of the different hits. So I don't want you to get an idea that this whole program is nutritionally based. It is there's a nutrition section that's a very important section. But we also, our largest section actually has to do on the thinking patterns and rational versus irrational, helpful versus thoughts that are not helpful. And of course, that's very fun for the students as well. But this is, we also have a review section. So I'll just show you a little bit about what's being developed here. Nutrition Part 1, Exploring the Brain. And of course, it gets into a little review. The time before, we had studied with them about gratitude. Gratitude is one of those things that can significantly improve your brain's ability and actually improve your emotional health, and it actually does things to improve your IQ, your ability to learn, retain, and apply knowledge. And so being intentional on developing gratitude lists are extremely important. And so I am grateful for, so that they can put down that, and that's part of the review. Also, they were reviewing the section, so each section also has a review, so you can keep going back. We had gone through the benefits of sleep, and even the best times for sleep. And name 2 benefits of sleep was asked earlier. I'm not showing you all the slides, but sleep facilitates learning, and it increases melatonin levels, which we explained to them what melatonin is. And how can you improve your sleep? And so there's sections in there or different aspects in regards to sleep hygiene and being able to improve sleep. By the way, do you think this is important for ninth graders? Do you think ninth graders have a problem not getting enough sleep? Absolutely. And one of the reasons why is because they're on technology late at night. We also teach them what happens with technology. You're always wanting to delay your circadian rhythm, so we're teaching them the advantage of getting rid of their phones and screens early to be able to have their brain most optimized, and it'll help them emotionally and intelligently. But we actually start out the nutrition section by asking them what their favorite car is. And you'd say, well, why is that the case? Well, they like to talk about cars, ninth graders, we understand that. And some of these most favorite cars actually require very specialized fuel to actually help them run the best. Some of these very expensive cars actually require, 100 octane of fuel, which you can't get at your regular station. And if you don't do that, you're going to actually adversely affect the performance of that vehicle. And it can actually adversely affect the life of that vehicle and things. So we take special time when we have nice cars to make sure things are done right in regards to the maintenance and what is put into that car. And then we give the illustration in regards to, are you less important or more important than a car? Do you think it's important what kind of nutrients you're getting into your body? And so this is a section from the ninth grade. These are nutrients or chemical compounds in food that provide nourishment essential for growth and maintenance of life. And we asked them some questions as well to get them dialoguing some in regards to what their favorite foods are and things like that. But macronutrients. And so these are the large quantities of nutrients that are needed, the carbohydrates, fats, and proteins. So we introduce them to the three macronutrients. And then we also introduce them to the micronutrients, which are things like the minerals and the vitamins and things that can produce some brain enhancing properties. And so then we go through the principles. The principles have to do with variety. Food variety means eating different types of foods from all food groups to ensure that we receive all the nutrients necessary for a healthy diet. Main food groups are, and we go through these healthy food groups. And notice here, fruits, vegetables, whole grains, legumes, and nuts and seeds. We go over the fruit aspect, and there's even studies that we can look at called eudaimonia. Let me see if I have a water bottle up here. I thought Erica brought one. Oh, okay, I see it here. And they also have to recognize them. When we put them up there before the fruit comes in, what is this, see what category it's in, and that sort of thing. But we do the study out of New Zealand called on eudaimonia. Eudaimonia is actually being happy and healthy and fulfilled and all of that. There have been studies that show that our happiness is actually related to how many servings of fruits and vegetables we eat in a day. And it's pretty amazing to see the linear relationship there of that. And so we try to get them encouraged to choose these types of foods. This would be a food as well. They're asking them what category is that in. And of course, yeah. Anyone recognize that? Yeah. All right, durian. Yeah, and this is also, you can see a little bit about the audience that we're dealing with, the piloting program. And let me explain a little bit more about this Ninth Circuit. So the Ninth Circuit is actually more involved in the day-to-day court system in the U.S. territories on the Pacific Islands than they are in California and Arizona, because all of those states have their own state court system and municipal court system. But the U.S. territories don't. So the Ninth Circuit is much more over those U.S. territories in regards to handling things. And so where we're piloting this K through 12 is actually in Guam and the 10 Pacific Islands associated with that. And that's where the Ninth Circuit was telling us they have the issues with domestic violence. Domestic violence wouldn't be a federal court issue in the other court systems that the Ninth Circuit is over, because that's not really federal. And so, but they are over those things, and of course that's why they're trying to improve the emotional health. What is this? It's passion, yeah, passion fruit, and this is something they would have on the islands as well. What's this? It's apricots, yep, all right, very good. And they have access to that as well. Of course, we had to look at what they did have access to as well when we're putting this together. We actually had to redo our textbook. Somebody won Millie last night. Millie has been totally redone for Guam and the islands. It's actually called Tua, which is one of the names over there. And all of the children look very different than they do in the Millie book, so that we can have it culturally sensitive. And then the vegetables that they have. Yes, artichokes. I think yeah. So, bok choy. Yeah, kale. Eggplant. And then we go into the grains. What type of grain is that? Yeah, those are oat groats. It is quinoa. Okay. What grain is this? Yeah, black rice. And of course, we teach them, or wild rice, we teach them all of the different types of rice as well. Often over in these islands, they're only familiar with the refined white rice, which actually is not as healthy for them. And then we also teach them what about white bread and the differences in regards to nutrients, in regards to brain health, in regards to whole wheat. So teaching them to choose only the whole wheat in regards to the omegas, the nutrients, the iron as well. A lot of iron deficiency there, and the white grains are going to add to the iron deficiency. And then we have legumes. What are those? Those are soybeans. Yeah. How about this? Black-eyed peas. Yep. Okay. Those are all different types of lentils. Is that correct? Yeah. There's a lot of different varieties of lentils. Pinto beans. Yes, and they have these beans accessible over there in Guam. And then we can, yeah, there's some chickpeas there as well. And then we go through the nuts and the seeds. What are those? Those are the Brazil nuts. Anyone know what this is? It is cashews. So then we would go into where the cashews actually come from. And of course, one of the great brain foods we talked about yesterday, walnuts. Flaxseed and hemp seed. And so we teach them in regards to the variety of these 5 food groups, and we also teach them the idea of freshness. And we want it to be fresh, We want it to have those varieties of those 5 different varieties, at least every day, multiple servings. And we also want it to be colorful. And so, of course, the anthocyanins help with that color. You have lycopene, you have those sorts of things that we'll teach them about that are healthy. And then we also ask them the question, is it free from chemicals? And so this includes food grown or raised without chemical fertilizer, pest seeds, weed killers, hormones, or drugs. This is the best. And so we also ask them the question that they can ask, can I grow it? And from farm to plate. If it's something that you can't grow, it's not going to be as healthy. And so that helps them to get rid of the processed types of foods and those sorts of things that we can't really grow. So the longer it takes for fresh produce to reach our plates, the greater the loss of available vitamins, minerals, etc. So variety, so we teach them the rule of 5. The variety in those 5 areas, is it fresh, is it colorful, is it free from chemicals, and can I grow it? or can it be grown? And so that will help them in regards to the choices of the foods that are best for them. And that's just nutrition part 1. So that would just basically, I went through kind of a quick a presentation of what a 40-minute, of course we have them do some more exercises during that time and things to make it interactive. But that would be their first nutrition in the brain section that they get in 9th grade and going through the emotional health aspect of things. And then on nutrition part 2, we're going to review some of those things, and then we're going to start taking them further in regards to that aspect. So some of you had asked to see what we're doing in the K through 12 system, so you're getting an idea there. But that's just one section that we could go through, and we could go through other sections as well. The cognitive sections are very fun for them as well. So what we've also been asked to do, and let's see if we can, maybe Art can come up and give me the next aspect of things. Our programs are, of course, physically, mentally, emotionally, socially, and also spiritually based. The frontal lobe is the spiritual part of the brain. And, of course, the book that is most connected to spirituality worldwide is the Bible. And so we have used the Bible as a mental health book and showing some non-sectarian examples of doing this. We actually do this in our program as well. And we actually use the book that is the least sectarian. In other words, the Muslims revere this book, the Jews revere this book, the Christians revere this book, and it's actually a great mental health book that we'll use in our residential program. Anyone want to guess what book that is that's revered by all of those? Proverbs is revered by all, but not as much as this book. It's actually the book of Daniel. You know, the Muslims have a big monument to Daniel, the prophet Daniel in Uzbekistan. They actually claim that they have his bones there. I haven't gone into the history to know whether they have them or not. But there's a big monument to Daniel there. Christ, when he's quoted as saying, study the book of Daniel. And of course the Jews very much revere Daniel. And so it's a one that really all religions can encompass and come. And there's stories. And they're actually historical stories, that there's a lot of historical backup there. And those stories all start out with significant disappointments as far as the emotional part of things and end up as an appointment. And then there's spiritual keys that build on each other that are non-sectarian keys again that we can grab onto to help our frontal lobes grow. And those in the residential program just love this. They've never actually looked at spiritual material in a mental health way. And it's a very, very positive experience that they gain out of this.
Which one would you like, the depression and anxiety or
Neither one. It's the one that that we had that one slide on, maybe. Yeah, I think so. The workbook. Yeah. So a number of people here in Rochester have gone through our 8-week program, and of course we incorporate some of this in our 8-week program as well on the spiritual side of things. But the city of Rochester, particularly the fire chief and those sorts of things, said, I would like to make this mandatory for every one of my employees to go through this educational program on depression and anxiety, because we see it so much, and of course post-fire you're going to see it, and then also the lives of the individuals involved in the department are very much, as a first responder, you're at risk for depression and anxiety, you're at risk of burnout, you're at risk of all of those sorts of things. And so they stated, we could make it voluntary in regards to what we're going through, but to make it mandatory, there might be accusations, with the spiritual material that somehow we're trying to force them into proselytizing or things like that. So, by the way, the VA looked at this a few years ago because many veterans have gone through our program and they've recommended it. And so the Veterans Association, being government and separation of church and state, looked at that and our spiritual material. It was an independent review by their attorneys. And they stated that because it isn't proselytizing, in other words, it's not trying to convince you of anything to join any denomination or church, and because it seems to add to the therapeutic benefit, and the whole idea is to become depression-free and anxiety-free, that they didn't see it as a problem at all for the U.S. government to recommend this because of the fact that it's part of the healing aspect of things. And so the VA actually signed off on it as being legitimate and fine. But in today's era, we have different groups that are very anti, and I know in Europe as well, sometimes there's very anti things, I think, due to misunderstandings in regards to the Bible. And so there could be, it could put some risk. Even though you're legitimate and all that, doesn't mean you can't get sued. You can get sued for anything. It doesn't mean you're going to get it successfully sued. And so the fire chief just stated it would be nice to be able to have those principles where we may not be at risk. And we were thinking of doing that anyways, particularly because we had to do the same thing in the K through 12 curriculum with the Ninth Circuit. And so we'll have some generic things on spirituality, but we're not having biblical quotes or those sorts of things in the K through 12 curriculum. And so we're actually, these are the 3 parts of this program. The first 2 are the mandatory parts of the program. And the first one is the workbook. We're updating the materials. Yeah, it is kind of hard to read there. I don't know if we can expand it or kind of enlarge it. So yeah, when the fire chief runs this program, everyone will get the first 2 in the set. Okay, that's about as big as we can get it. And so we have the Depression Recovery Program workbook material, and we're actually developing that right now with newer material. Then we have the supplemental reading material. For those of you that have gone through our 8-week program, we use, William Backus, Telling Yourself the Truth. We use Lynn Clark, SOS for Emotions. We also have the Depression the Way Out textbook. And it's quite a bit of reading if you're going to keep up with all of that. And so what we're doing is taking the highlights of different sections and putting it together into one book where you will only be needing to read about 3 to 5 pages a day to make it more to be able to catch up with that. And the lost art of thinking is going to be incorporated in that. Some of those highlight studies from the 10 different distorted ways of thinking, that's going to be highlighted in that as well. And so that way the reading material isn't too exhausting, particularly for those with OCD that want to, do everything and keep up with everything. It makes it a little easier for them to be able to digest that. And then the third one is the optional one, but this is actually a gratitude journal that also has the spiritual aspects of the program that we took out, essentially, but in a different setting. And okay. This is the workbook. It'll have the 8 sections again, and you can see some things. How to improve your brain, session 1. This is giving you an idea of what's the layout of the workbook there in session 1 and how it's easy to go through. And then we have a section on week 1 on reflection and gratitude. Oh, I'm sorry. This is the third book that would be the optional book. So the third book and optional book is the reflection and gratitude that keeps up with the same weeks that are there. And how the fire chief explained this to us is that he said, this is something, we have a chaplain. This is something the chaplain could actually help out with and have that be an option. So this wouldn't have to be, and none of them would have to get this section of things. But if they really want to get that spiritual aspect and improve it, they could, that would be the option for them to go this route. And it does go along with the 8 sessions in regards to the reflection and gratitude. And then there are some Bible quotes in regards to our amazing brain and those sorts of things. And then you can see the daily gratitude and then my response to that in regards to commitment on that third book. So that gives you an idea of what's going to be coming out in 2023. We're going to have this material already for print by fall for all the sections, and we'll have it refilmed as well. And then in 2023, we'll hopefully, as long as we don't have supply chain issues, which there are supply chain issues in printing right now, we should have all of that ready by early 2023. And this will make it so that every government agency that wants to use it can utilize it without feeling like they're at risk over the situation. So any questions at all about that? When do we get a copy? Yeah, after it's printed and ready to go. Yes. Right.
It's just, so I mean, it's just a great way to bring that into the spiritual side of it, and Daniel trusting.
Yeah, there's the physical side of that as well, and then also have you the abuse side as well. There's a lot of abuse that those 4 underwent, and then you see the emotional aspects of those dealing with them in regards to anger and all of those. And so those have all become analysis points in regards to why was Nebuchadnezzar angry? What were his thoughts behind that? Were those thoughts rational or not? He got so angry at the wise men he was going to kill them all off, and would have had Daniel not stopped the process. But he thought he had every right to be angry. And so you can actually get a lot of the cognitive behavioral therapy aspects in regards to that. Yes.
I have a question. This new program in 2023, is this going to replace the NDARP? The 8-week program, 9-week?
So yeah, it'll still, it really is an upgrade of the 8-week program. Yeah, the NDARP. And so yeah, and so there's actually going to be also 2 filmings since so many churches. We have this run, and this program currently is run in a lot of Catholic churches. It's run in a lot of Methodist churches, the Latter-day Saints also utilize it, Lutherans, Methodists. So it's run in a lot of different churches, and those churches would like that spiritual aspect to stay there, and we think it's actually better with that spiritual aspect. And so we're going to have 2 different filmings, one for more of the government non-biblical side of things, and then we'll also have a filming for the Christian or the biblical side of things. So you'll be able to choose one of 2 options when you actually get the filming.
Okay, so the film, the 1 hour is going to be, you know, spiritual, non-spiritual, and then you've got the facilitator session. That's up to them, and then they both use the same workbook, reading material.
Correct.
It's going to be consolidated?
Yeah. For those who are already directors and facilitators, we'll actually have a little bit of additional training in regards to the new material, so you don't feel like you don't know exactly what's going on and how to be able to utilize that. There are a few little differences where we only spend 1 out of the 8 weeks right now on cognitive behavioral therapy, although we refer back to that and we do other aspects of CBT in weeks 5 through 8. But we believe CBT is so important that we're actually expanding that to 2 entire sessions. And so we're doing the lifestyle parts first, then the CBT, and then the combined approach in 6 through 8. So we're making a few tweaks like that to hopefully improve the program. And so directors and facilitators will be kept up to date in regards to all of that. Yes?
We can backpedal. In the beginning, you talked about optimize your brain. And I was wondering, last time you discussed that one of the biggest problems that we have right now is we know what to do, but we don't do it because we lack that self-control. And my question is that this optimize your brain, does that fill in the gap between the knowledge and the implementation? Would that help in that?
Yeah, absolutely. We do talk about the implementation phase very very carefully and well done in the Optimize Your Brain section, as well as the self-control section of things. And but of course, that's also a piece in NDARP as well, because we have to tell people at the end of the day, this program does not work. A lot of people talk, this program works wonderfully. It actually doesn't work by itself. It's the individual working the program that gets it to work. So every person that improves has to be congratulated because they had to change on their own and implement these types of things. Yes, the information and knowledge helped to motivate them to do so, but they still had to do it. And we have to do these things in order for our brain to change. Our brain is going to change because it's such a neuroplastic, meaning that it's so capable of changing the way it's designed. It doesn't change, even a great baseball player does not become a great baseball player in 2 days. They have to spend a lot of time practicing that sport. And if we're going to have our best brain health in regards to emotional health and all of that, it takes some work on our part, but it's well worth the effort. And the self-control piece is critically important.
Is that done primarily offline? Is that an individual-based thing, or how does that?
Okay, so Optimize Your Brain can be online, and we also have community-based programs. So a lot of people that run depression and anxiety recovery programs might alternate between that program and the Optimize Your Brain program. The Optimize Your Brain program particularly is very important in schools as well. And actually, that's we're using that as somewhat of our model in the K through 12 system. So the K through 12 system, we're actually using the principles of Optimize Your Brain and then breaking it down. I wish we could show them the grades 1 through 4 aspects. There's some very fun things going on in grades 1 through 4. And the parents of our kids and our teachers are just amazed at how much these kids love to learn about brain health. I mean, they're going home and they're talking about their amygdalas and they're talking about their frontal lobes and their hippocampus in regards to memory. So we teach them all these things in fun ways, and then we teach them on how to enhance it. And they get really pumped over this, even in the younger age groups. And then to actually manage themselves. I mean, one story we got recently was this young boy, he's like 8, that had a lot of temper issues. And somebody from the family spilled something over some sort of craft that he was doing, and it basically ruined the craft. And he just, you could see his face flush and all of that. And then he calmed himself down and he says, "I can handle this." And his parents were just amazed. And of course, they're just praising the teacher. How in the world did this happen? But it was the cognitive aspect of things, helping them to build frustration tolerance and how they could deal with that produced those type of effects. So I'm looking forward to exciting changes taking place in our nation. We have to start small in little groups one at a time, but there is a possibility that more public school systems could hang hold of this. We are doing it in ways, one of the things we got a complaint in regards to some of the teacher aspects of Guam and the public school system is, how come you're not teaching them in regards to LGBTQ and all of these other things? But that's not our goal. Our goal is emotional health. And so we stayed out of the sex business and the sex arena in this program. Actually, to do so would not have been wise, because there are some people that if you put that in there, they're not going to want to have their school system have it, and you just divide people over this. We can teach people about emotional reasoning. Emotional reasoning is one of the distortions, and it's one of the great issues of our day, is not understanding the aspect of emotional reasoning. But we can teach them without going into any of the sex stuff. We can teach them about those sorts of things, and once they understand the principles, they might be able to apply it in other ways. But we're staying out of the controversial arenas so that we can get these principles widespread, because a lot of these basic principles our kids and our parents don't know very well. And so we need to start where it can be generally accepted by virtually everybody. Well, thank you. Hope this is helpful.
Thank you so much, Dr. Nedley. Thank you, everyone, for your questions, too. So a couple of things before we wrap up. For those of you who have asked about the taping, the videos, we've recorded all of the sessions. They were actually recorded live on Facebook on the Lotus Health Foundation Facebook page. So you can go there and find them there. Any additional information, you can go to lotushealthfoundation.org and find out about the events that Lotus Health Foundation is sponsoring. This event here yesterday, today, the Community of Wellness Symposium is initiated and funded by Lotus Health Foundation. So certainly, please take a look over there and support us as much as you can. Let's see. Also, additional information, if you're still here, we have a couple of tables still in the other room. I know Dr. Nedley and Erica, do you have your tables still available? No? Okay. So, again, take a look at lotushealthfoundation.org. You can also find Dr. Nedley and his information on his website, which is?
Nedleyhealth.com.
Nedleyhealth.com. How simple is that? Let's see, what else? I think that might be it. I'd like to thank you for attending the Community of Wellness Symposium. Again, the event is sponsored and put together. Really, it's all done from Lotus Health Foundation, May, and the group over there. Rochester Clinic, the Seventh-day Adventist Church, and all of the other community partners who are here. Living Healthy List, that's me. We'd like to thank you for your time. Thank you for being here, and we really hope that you will plant the seed, as we've been talking about for the last 2 days. It all starts here with you. Lead by example, and use the resources that we have available. You saw some resources yesterday. Dr. Nedley is an incredible resource. Lotus Health Foundation, Living Healthy List are incredible resources for you personally and for your community. I'd also finally like to say Happy Mother's Day tomorrow to all the moms and the aunts and the grandmoms So have a wonderful, wonderful day. Enjoy the rest of the day. It's still sunny and warm out. Erica, we'd like to thank you also for being here for the amazing session you gave us yesterday, for the delicious food and the recipes that we're all looking forward to. Thank you, everyone.